The Ministry of Health Singapore has developed this training video to highlight the various aspects of SARS-related infection control. All the recommendations for protective attire are consistent with the best practices set by the World Health Organization. This video describes in detail the compulsory protective measures for healthcare workers who have contact with SARS suspect, SARS probable patients, and febrile patients where SARS has not been excluded. These measures are designed to prevent the spread and transmission of this disease and must be followed as described. To begin with, personal protective equipment or PPE for contact with SARS suspect or SARS probable patients includes fit-tested N95 mask or equivalent, goggles or face shields, disposable long-sleeve gowns, and disposable gloves. Hand hygiene must always be performed whenever there is any contact with patients, their environment, or equipment which has been used in their care, and it must be performed in the following situations: between patient contacts, before donning or after removing protective apparel, after contact with any respiratory secretions, after removing the mask, before leaving the isolation area, before touching your personal items, and before meal breaks. Hand hygiene is necessary even if gloves have been worn. Before and after contact with patients, wash your hands with soap and water, or use a hand rub if soap and running water is not available. Make sure all skin surfaces come in contact with water and soap or with hand rubs and are rinsed thoroughly. Watches and jewelry may limit the effectiveness of the hand hygiene and must not be worn. Remember, hand hygiene must always be performed. Between patient contacts, before donning or after removing protective apparel, after contact with any respiratory secretions, after removing the mask, before leaving the isolation area, before touching your personal items, and before meal breaks. The N95 or equivalent mask must be used according to manufacturer's instructions and fitted so that there is a proper seal between the respirator's sealing surface and the wearer's face. It must be secured over both the nose and the mouth. When putting on the mask, pick the mask up in your cupped palm and press it firmly against your face with the nose piece on the bridge of the nose. Stretch and position the top band high on the back of the head, followed by stretching the bottom band over the head and below the ears. Mold the mask fit by pressing the aluminum nose piece with hands to tighten it. Do not pinch the nose piece. Perform a user seal check by exhaling and checking for air leaks around the mask. If the mask is dislodged or removed, a user seal check must be performed again. Once worn in the presence of a SARS patient, the mask should be considered potentially contaminated with infectious material, even if this is not visible, and touching of the mask should be avoided other than to check the seal if it has become dislodged or is being reused. If a sufficient supply of respirators is not available, healthcare facilities may consider reuse as long as the device has not been obviously soiled or damaged. If N95 respirators are reused for contact with SARS patients, implement a procedure for safer reuse to prevent contamination through contact with infectious droplets on the outside of the respirator. Consider wearing a loose-fitting barrier that does not interfere with fit or seal over the N95 mask. For example, surgical mask or face shield. Remove the barrier upon leaving the patient's room and perform hand hygiene. Surgical masks should be discarded. face shields should be cleaned and disinfected. Remove the N95 mask and either hang it in a designated area or place it in a bag. Consider labeling N95 masks with the user's name before use to prevent reuse by another individual. Use with care when placing a used N95 mask on the face to ensure proper fit for respiratory protection and to avoid contact with infectious material that may be present on the outside of the mask. Discard the bag that the used mask was stored in. Perform hand hygiene after replacing the N95 mask on the face. If N95 or equivalent masks are not available, a surgical mask should be worn. Surgical masks will provide barrier protection against large droplets that are considered to be the primary route of SARS transmission. The mask should resist fluid penetration and fit tightly around the mouth and nose when properly applied to the face. Goggles or a face shield are worn by staff to avoid splashes or sprays of body fluids, secretions or excretions to provide protection of the mucous membranes of the eyes, nose and mouth from contact transmission of pathogens. They should be assigned to each worker at the beginning of their shift and worn when entering the probable or suspect SARS patient's room or when in direct contact with these patients. Long-sleeve surgical gowns should be worn when in direct contact with probable or suspect SARS patients. This is to prevent contamination of clothing and to protect the skin of personnel from blood and body fluid exposures. It is preferable to change gowns between patients, but if supplies are critical, gowns may be reused during one shift. If gowns are reused, they should be hung in a way that enables the user to identify the front of the gown and ensure that the gown is always worn front out first. If soiled, wet or visibly contaminated, gowns should be discarded and changed immediately. Disposable gloves must be worn at all times when in contact with probable or suspect SARS patients, the environment, and any equipment used in their care. Wearing gloves does not replace the need for hand washing because gloves may have small, inapparent defects or may be torn during use, and hands can become contaminated during removal of gloves. Please refer to your own local hospital infection control guidelines as to when to reuse masks or gowns. Avoid touching the contact surfaces when removing gloves. This can be done by rolling the gloves downwards starting at the cuff. Gloves must be disposed of in the biohazard waste. Wash hands with soap and water or use hand rub after removing and disposing of gloves. To discard gowns properly, fold contaminated surfaces inward and rolled up gently. Do not flip or shake the gown. Discard the gown into designated biohazard waste bins. Hands and arms should be washed or hand rub used after removing the gown. Stethoscopes and any other reusable equipment, such as goggles wear used in the care of a suspect or probable SARS patient, must be disinfected after use. Alcohol-impregnated wipes or another appropriate disinfectant should be used to clean every part of the stethoscope or piece of equipment. Wipes should be discarded in the biohazard waste. Hands should then be washed or hand rub used. Healthcare workers should avoid handling the front of the mask as much as possible during removal. Masks worn in the care of a suspect or probable SARS patients should be discarded in the biohazard waste, and healthcare workers should wash their hands immediately. Where available, powered air respirators or PAPR should be used for high-risk procedures, including chest physio, bronchoscopy, gastroscopy, and intubation. The components for PAPR include calibration tube, airflow indicator tube, turbo body, one pair of cartridges, head top, breathing tube, and battery. To charge the battery, connect the charger to battery and plug to power supply. Make sure the battery is fully charged prior to assembly. Fit the calibration indication tube to the turbo airflow outlet tubing fitting at upright position without the cartridges attached. Press the on switch and continue depressing the button until the black ball reaches the minimum airflow marking. Release your finger from on button and switch off immediately when it reaches this level. This is to ensure that the alarm is activated when the airflow goes below this preset level. Calibration should be performed at least once a month. To assemble PAPR, slot battery into turbo body and attach the two cartridges. Always leave the cover on the cartridges. Perform airflow check before every use. Fit the airflow indicator tube to the turbo airflow outlet tubing fitting, making sure the tube is in an upright position with two cartridges attached to the turbo body. Press the on button and the white ball has to reach above the minimum airflow marking. If the white ball falls below minimum airflow marking, check if battery is fully charged. Otherwise, the cartridges are due for replacement. Connect head top to turbo body using the breathing tube. It is now ready for use. To put on PAPR, buckle the waist belt with the unit around your waist and adjust the belt according. And don the head top and adjust it accordingly with the strap provided. Switch the on button and make sure the fan and battery indicated light is not red. Please ensure that the gown does not cover the turbo body. Perform hand hygiene before putting on glove, then proceed with your procedures. The PAPR should only be removed after you have vacated the contaminated area. Turn off the air filter unit only after you have undone the head top. Unbuckle the waist belt and clean PAPR. It is recommended that all the consumable parts of the PAPR, for example, the head top and cartridges, be discarded after a single use. The reusable elements should always be cleaned and disinfected after use. in accordance with the manufacturer's recommendations. Components including turbo body, battery, breathing tube, and head top should not be submerged in liquid. Please refer to your own hospital infection control guidelines should you need to reuse parts of PAPR. Healthcare workers caring for patients with severe acute respiratory syndrome or SARS are at risk for acquiring SARS. Although the infectivity of SARS is currently uncertain, transmission to healthcare workers appears to have occurred after close contact with symptomatic individuals, particularly before implementation of recommended infection control precautions for SARS. Personal protective equipment as demonstrated in this video must be used by healthcare workers caring for probable or suspect SARS cases and febrile patients where SARS has not been excluded to prevent transmission of SARS in healthcare settings. Please refer to your own healthcare organization's infection control guidelines for further details. Always remember, do not touch the outside of your mask. Avoid touching your face, eyes, mouth, or nose unless your hands are washed or hand rub has been used. Do not write notes, answer pager, or use phone until you have washed your hands. Make it a habit to wash your hands regularly and to adhere to all protective instructions. The Ministry is grateful to all Singapore General Hospital management and staff who assisted in the production of this video.